trauma video. Take 9. Alright, scene save. Or what do I got?
All right, you're being dispatched to a young, unresponsive female found sitting against a wall. Bystanders do not know patient.
First of all, scene save, PPE, BSI.
Scene is safe.
Okay, coming up. What do I see? Do I see any major bleeds or anything that needs imminent treatment?
You find an obvious open bleeding wound to her chest.
Okay, I'm going to cover that immediately. I'm going to have my partner address that with an with an occlusive dressing. I'm going to request additional ALS service. I'm going to try to find out what the mechanism of injury is. I don't, at this point, that is unknown. I am going to have somebody take stabilization of the spine, and we are going to transfer the patient to a supine position. I'm going to assess the airway and breathing.
Breathing is 10 and irregular and shallow. Airway is patent.
Okay. Unconscious patient, I'm going to measure and insert an oral pharyngeal airway. Based on the respirations, I'm going to have my partner implement the bag valve positive pressure ventilation, and that will be hooked to supplemental oxygen at 15 liters. I'm going to check the pulse and color, skin temp, condition.
Your pulse is 38 and weak with warm and pale skin and cyanosis noted around the lips.
Okay, I'm going to have my partner go get the backboard. I am going to do a quick rapid assessment and check the head for bleeding. Do I have any bleeding in the head?
No bleeding, but a left temporal bone deformity.
Okay. At this point, we're going to just quickly check the chest area, and going to get a set of lung sounds, and I'm going to palpate the abdomen, and I would have my partner measure and instrument a C-collar at the same time, and then I would address the pelvic area.
Everything so far is clear.
Okay. Then I would have my partner on the count of on the head count, is roll the patient and inspect the back for deformity and bleeding, and then we are going to backboard the patient.
Clear.
And we are going to then get her into the hospital, into the ambulance, and then we are going to perform a secondary. So I would have my partner get a set of vital signs.
Your vitals are a blood pressure of 50/20. Your pulse is 38 and weak and breathing at a rate of 10 and irregular.
Okay, so we're going to continue with the oxygen therapy. I'm going to do a secondary. I'm going to, again, feel the head and check that. I'm going to check the eyes and for pupil reaction.
Non-reactive pupils.
Okay, and I'm checking the ears and nose for fluid or blood. Okay, again checking through the collar to see if there is deviation or JVD.
Clear.
Okay, and then I'm coming down palpating the clavicle area.
Clear.
Right, again, we're going to reassess the wound, make sure that dressing is effective. Going to do the chest. Going to have another set of lung sounds.
Your partner tells you that the lung sounds are diminished in all fields.
Okay. I'm going to palpate again, checking to see if there's grimace.
Clear.
In all 4 quadrants. Reassessing the pelvic and the genitalia area, pubis.
Clear.
Okay, then checking the extremity.
Clear.
For CMS. Pulse.
Weak pulse.
Okay.
No grimace.
Okay, and then checking the right leg. Checking for pulse.
Clear, no grimace, and pulses there.
Okay. And then checking the arms, extremity, CMS, pulse.
Clear, no grimace, and pulses present.
Okay. Inspecting the other arm.
Clear,
Pulse.
pulse is present, no grimace.
All right. Now at this time, we would reassess this patient every 5 minutes. We would treat for potential shock by covering the patient with a warm with blankets, administering the high flow oxygen, and rapid transport. And the fact that she is laying flat, that's already the position in supine position for shock as well. So that's what I got.
I think that